So welcome. This is, I guess, Innovarx Global Health 1 year later. So obviously 2020 was a really good year for us. Had a lot of opportunities to help a lot of individuals, a new way of delivering healthcare to individuals all over the Gambia, from Banjul to Basse as well too. That's evolved a lot of different ways where now we've incorporated things like text messaging for orders. 1881 now is the number that we have. Transportation barriers was one of the things that we wanted to remove when it comes to how people consumed healthcare. So as we walk into the store, this is what we consider our main retail space. The design, a lot of people, it might be foreign because typically a lot of healthcare facilities, products are not accessible to customers. But one of the things we wanted to do is design it in a way that it flows in the most convenient way, not for us, but for the customer. So we have each section divided, what you normally would see in a typical retail space. So one of the things that we're really proud of that's grown a lot in the year. So when we opened the company, yes, we were proud that we were bringing in quality products into the country, but we realized as well too, within the Gambia, we had a lot of talented entrepreneurs who were making amazing products, but did not have the opportunity to have shelf space in stores, especially in a way that it's beneficial for the entrepreneur in terms of their goods being purchased on site. So that's where For Gambia by Gambia came about, something that we're extremely proud of. It's grown, as you can see, from last year, where now I think we have about a dozen local entrepreneurs who make products from soaps, different powders of our local foods. I think it's interesting where we see the West now, they're picking up on a lot of different foods that we've taken for granted. Findi, more commonly known as fonio, baobab, moringa, all of these are available in Gambia in abundance. So it's only right that as a company, we champion the very best of what we have as well too. So the store just flows the right way. In terms of feminine products, we have a section for all our women's products as well too. This is a lot of the non-clinical retail space that we have. Obviously we like the fact that it feels like a startup environment where it's co-work space, a lot of collaborative ideas come into play. Our online store is ran from this room as well too, from a delivery standpoint. So we have our digital sales officer, Usman, who handles a lot of orders that come through digital means. Delivery and dispatch also happens from this area. Security, very important when it comes to how we deal with our customers. Every single package, I think it's really important that even our drivers don't know what the patients are receiving. So it's just incorporated into the whole process. So here we normally house, this is the room that I normally sit in. Our marketing team normally sits in here. Hadi So is our marketing lead. We have Awajan, who's our product specialist. So all the inventory management, wholesale operations, our finance team, very dynamic individuals who are the brains behind the company. And then we also have a clinical coordination end to the company, which here, obviously, our clinical coordinator, Nani, sits. So she deals a lot with individuals who are coming in to have a clinical experience. So obviously, we do a lot of preventative services when it comes to disease management as well, too. But the process flows better when individuals like Nani are able to kind of facilitate what happens from the moment they walk into the facility. One of the key things that she does too is collaborate a lot with people in the diaspora who often are the ones who are sponsoring their loved ones. And I think that's where the dynamic between our clinical coordinator and our health outcomes coordinator, which Ms. Lana is one of our health outcomes coordinators, come into play. They are the brains behind our care plan subscriptions. They manage these individuals who buy yearly packages, and then that yearly packages come with obviously the routine exams that they need, the medications delivered to them everywhere in the Gambia. So it's just a very dynamic group that we've been fortunate to have over the year as well. So in terms of our clinical operations, the right corner as I call it, is where most of the work is done. Telemedicine services is something that we're proud to be championing. We're privileged to have an electronic health record system, Augusta, which is cloud-based. It allows us to interface with physicians, practitioners all over the world. But the clinical team, which comprises of our nurses, our staff, I believe we have a nurse, Miss Janet. It's one of our senior nurses here as well. So they triage a lot of the customers who are here for clinical services. So our point of care testing room, point of care test, a lot of people here, it might not be familiar. It's just rapid diagnostic tests. So these are tests like diabetes H1C tests, cholesterol tests, hemoglobin tests, kidney function, liver function tests that we all conduct in this room. And it's extremely convenient because you get your results within minutes. Augusta is such a powerful tool for us because we have a totally digitalized healthcare ecosystem as a company. We don't keep manual records. Every single interaction that happens clinically is interfaced with our electronic health record system, which is Augusta. The clinical team are a huge part of the Wellness on Wheels program because they do a lot of visits to people's homes. So most of the tests that we could grab our portable devices and conduct the test here, we have the capacity now to go to people's homes, get the test done, and deliver the results within minutes. So this is where all of that happens from a clinical standpoint as well. It's extremely important for more people to know who their pharmacists are, right? Because it has that relationship that just prevents a lot of things from happening when it comes to knowing what to take, how to take it, when to take it. So this is our pharmacy section for the company.